Hello! You are watching this video because your heart doctor has determined that you have a type of heart failure that may respond to a device-based therapy called cardiac contractility modulation, or CCM, and wants you to consider participating in a clinical study designed for patients like you. Symptoms of heart failure include shortness of breath, tiredness, and a general feeling of weakness. Prolonged, persistent cough, accumulation of excess fluid in the stomach or lungs, swelling in the limbs, and arrhythmias of the heart can also occur. Your heart's job is to pump blood throughout your body and contains two separate pumping systems, the right side and the left side. The right side of your heart receives oxygen-poor blood from your body and pumps it into your lungs. The left side of your heart receives oxygen-rich blood from your lungs and pumps it back into your body. Both the right and left sides of your heart have two chambers that pump the blood, an atrium and a ventricle. But the left ventricle serves as the workhorse of this pumping system. Heart failure does not mean that your heart has stopped working. It just means that it doesn't pump blood as well as it should. Healthcare providers typically describe heart failure using two medical terms. First, there's a term called the ejection fraction, which is sometimes abbreviated simply as EF. The ejection fraction is a measurement of how much blood is pumped out by the heart's left ventricle with each contraction, and it is expressed as a percentage. For example, an ejection fraction of 60% means that 60% of the total amount of blood in the left ventricle is being pushed out to the body with each heartbeat. Depending on different factors, an ejection fraction above 50 to 70% is considered normal. Heart failure can occur in patients with relatively higher or relatively lower ejection fractions. Patients with an ejection fraction less than 40% are described as having heart failure with reduced ejection fraction, or HFrEF. There are many treatment options that have proven to be effective in patients with HFrEF, including medications and implantable medical devices. Patients with a higher ejection fraction between 40% and 70%, like yourself, have fewer treatment options that have been proven to be effective. The medications and devices which have proven to be effective in HFrEF, unfortunately, have not shown the same benefit in patients with higher EF heart failure. The second way of describing heart failure is based on symptoms. Your provider has determined that you have symptomatic heart failure based on your medical history. Patients with symptomatic heart failure are often forced to live with symptoms that impede some or most of their basic daily activities. Commonly, they find it difficult to walk a city block, climb a flight of stairs, or walk across a parking lot without experiencing fatigue or shortness of breath. Impulse Dynamics has developed a new form of treatment designed to improve how the heart functions, allowing more oxygen-rich blood to reach the body. Cardiac contractility modulation, CCM therapy, is delivered by a device called the Optimizer Smart Mini device. CCM therapy consists of precisely timed electrical pulses delivered to the heart. Unlike a pacemaker, which also delivers electrical pulses, CCM does not affect the rhythm of the heart. Instead, CCM pulses are designed to improve how the heart functions. Over a relatively short period of time, these pulses will positively alter the processing of proteins essential for normal cardiac function. CCM therapy may be an option for reducing the common symptoms of chronic heart failure. As a result, patients may experience improved mobility and return to the activities they normally enjoy and have been missing out on. The Optimizer device is similar in size to a pacemaker and is implanted during a minimally invasive procedure while you are under light sedation. The device is implanted under the skin of your upper chest, just below the collarbone. A cardiologist will conduct the operation, placing two electrical leads in your heart's right ventricle through the veins. The procedure is straightforward. and you will be discharged after a short observation, most often on the same or next day. From the comfort of your home, you charge the device each week for approximately 90 minutes using an external charger. During charging, the device informs you whether it is operating normally. CCM therapy is painless and unnoticeable. You can resume your normal activities in accordance with your doctor's instructions. The Optimizer CCM therapy delivery system is one of the treatment options already proven to be safe and effective in patients with heart failure, specifically with EF between 25 to 45%. Prior clinical studies have shown that patients with an EF 35 to 45% benefited from CCM the most, and that CCM could therefore be a promising therapy for patients with higher EF. The AIM Higher study is designed to determine whether patients like you with higher EF heart failure will benefit from CCM therapy. Your heart doctor is an investigator in the AIM Higher study and would like you to consider enrolling as a participant in the research study. Your doctor has determined that you meet the qualifications to be screened for participation in this heart failure study. There will be 1,500 patients enrolled at over 200 study sites worldwide. All patients will receive the Optimizer system, but not all patients will receive CCM therapy for the first 18 months. This research study is designed as a blinded study, which means neither you nor your doctor will know whether CCM is turned on or not for the first 18 months. 2/3 of the patients will have CCM therapy turned on from the very beginning, and it will remain on thereafter. 1/3 of the patients will not have CCM therapy turned on for the first 18 months. Patients in both groups may be followed for up to 5 years. The study will compare the following between the two groups: CCM on for 18 months and CCM off for 18 months, health status, exercise ability, rate of heart failure hospitalizations, rate of death. As with all the research studies, there are potential risks and benefits of participating. Your doctor can discuss these with you to help you decide if participating in this study may be right for you.